Community Health System is changing its approach to staffing. They've recently implemented a new software system called ANDGO, designed to make scheduling faster and more efficient. Jon Stabbe is the Director of Workforce Management at Community Health System and saw the need to make things more efficient.
Day to day, we look at all things staffing. When I first came into the role, it was a very manual and I would say tedious process. When we would have a call out, we were scrambling.
If a nurse were sick, finding a replacement took an average of 30 minutes. Jon felt there had to be a better way.
I was looking for a solution that would utilize technology better and get staff to the bedside and ultimately care for our patients.
That's how Jon discovered ANDGO, an automated system that notifies employees of open shifts and seamlessly allows them to fill those gaps.
When I spoke to ANDGO, they really understood our challenges. I originally went to look for a call system that would just take the call out, so I didn't have to have staff operating 24/7. Lo and behold, I found out that not only would it take the call out, it would start communicating to staff that there was an open shift, and then it would automatically schedule the individual who accepted the shift.
11 years ago, ANDGO Systems saw that many hospitals were having the same staffing issues. Co-founder and CEO Tom Ross says he knew there was a way to help.
And so we started to develop tools, software tools, to help sort of support basically the real-time movement of staff. So by able to receive those phone calls, be able to update the schedule manually, be able to notify units, and then start to create call lists and notify folks that can come into work.
A process that was previously taking employees 30 minutes could now only take 3.
And so with ANDGO, what we're able to do is we're able to reduce that down to 3 minutes or less. And so by automating all those manual tasks, you're giving back 27 minutes per sick call to your staff to focus on more important problems. And you add that up, you scale that across an organization as large as Community Health, and you get significant time savings that you can reinvest back into better care for the patients.
And then beyond that, it provides metrics. It provides tons of resources for employees to utilize the app and to schedule themselves. It went well beyond what I was looking for.
Community was an early adopter, and so far, results have been positive.
We're able to operate within an entire scheduling period, so approximately 6 weeks. And folks are more willing to pick up those shifts if they have the advance notice. And during our first year of ANDGO, we were able to fill 22,000 shifts in that first year, which to me, when crunching the numbers, was absolutely amazing. There's no way that my staff could have filled that many shifts doing that in a manual process.
The team that we've been working with at Community Health has been phenomenal. Just from a project perspective from the very beginning of just being an open and willingness to, essentially Community Health change the way they communicate available shifts with their employees. And that's a big change.
And the goal of ANDGO is simple: to spend less time on staffing concerns and more on patient care.
What's really cool from my seat is, as the creators of this technology, at the end of the day, ultimately it's a tool. It's a tool to help enable hospitals, provide more effective care for their patients and create, advantages and benefits and flexibility for their staff.